Several viruses have been associated with high mortality rates, depending on various factors such as the virulence of the virus, the population affected, and the availability of medical resources. It's important to note that mortality rates can vary over time and may differ among different outbreaks. Here are some examples of viruses historically known for their high mortality rates. Ebola virus. Ebola virus disease, EVD, has caused several outbreaks in Africa, with mortality rates ranging from 25% to 90%. The 2014 to 2016 outbreak in West Africa had a mortality rate of approximately 40%. Marburg virus. Marburg virus belongs to the same family as Ebola virus and causes a similar disease. Outbreaks of Marburg virus disease have resulted in mortality rates ranging from 24% to 88%. Nipah virus. Nipah virus is a zoonotic virus that can be transmitted from animals to humans. Outbreaks in Malaysia and Bangladesh have had mortality rates ranging from 40% to 75%, with the highest rates associated with the Bangladesh outbreak in 2004. Hantavirus. Different strains of hantavirus cause various diseases, including hantavirus pulmonary syndrome, HPS, and hemorrhagic fever with renal syndrome, HFRS. Mortality rates can vary depending on the strain and region, ranging from less than 1% to over 15%. Rabies virus. Rabies is a viral infection transmitted through the bite of an infected animal. Once symptoms appear, the disease is almost always fatal. The mortality rate of rabies is close to 100% if not treated promptly after exposure. MERS-CoV. Middle East Respiratory Syndrome coronavirus. MERS-CoV causes severe respiratory illness with a mortality rate of around 35%. The majority of cases have been reported in the Arabian Peninsula. It's important to remember that mortality rates can vary based on various factors, including the availability of medical care, treatment options, and the overall health and demographics of the affected population. The information provided here is based on historical data, and new outbreaks or mutations of these viruses could potentially change their mortality rates.